Kyrgyz Cardiological Society, and I'm cardiologist and employed in the Akhunbayev Kyrgyz State Medical Academy. Is my voice audible? Can I start?
Yes, please.
Yes. Dear colleagues, good afternoon. I express my gratitude to the organizers of the 35th Great Wall International Congress of Cardiology and Asian Heart Society Congress 2024 for their opportunity to speak with report at this prestigious Congress. This slide declares that there is no conflict of interests. Actually, increasing of the level of the blood pressure is significant contributing risk factor to global death rate, and this has been confirmed in multiple clinical studies. And now I would like to present you the result of a very important publication recently published in the Lancet journal. As you can see, risk factors are here have been analyzed, and here this table is representing risk factors. They are connected by lines between time periods. Solid lines represent an increase or lateral shift in ranking. Dashed lines representing a decreasing in rank. And here, this is results of analysis of 25 most important risk factors comparing from 2000 year and 21 years later. And here you can observe that the first top risk factor contributing to disability adjusted life year, this is poor air pollution. But the second, the top risk factor, this is increasing of the level of systolic blood pressure. And nowadays, the increasing of the systolic blood pressure is remaining the leading risk factor. It contributes at 7.8 percentage of total disability adjusted life years. Now, that's why the increasing level of the blood pressure, systolic blood pressure, is remaining very important factor contributing to outcome of population. And we would like to represent results of the investigation of the adult urban population of the Bishkek city. We included all patients older than 18 years old and older with written informed consent for participation. And we intended to identify individuals with increased systolical or diastolical and or diastolical blood pressure in order to on-time correction of the hypertension accordingly recent clinical guidelines. We included adult people, citizens of the Bishkek city, residents of Bishkek city, and this screening of the level of blood pressure in adult urban population was performed this year during May month measurement days. We didn't include patients who refrained on voluntary consent to participate in the study, and younger than 18 years old was also an exclusion criteria. We performed measurement of the blood pressure. Then sitting blood pressure measurement was performed according to the standardized specific methods recommended in recent clinical guidelines. Except measurement of the level of the blood pressure, all participants were asked questions about awareness of the hypertension, and the second question about taking antihypertensive medication in case of presence of the increased level of the blood pressure. And measurement of the blood pressure was performed in both hands, and we repeated 3 times measurement of the blood pressure, and average parameters of the blood pressure were taken into account. According study protocol of this investigation, the study protocol was approved by the ethical committee of the Akhunbayev Kyrgyz State Medical Academy, and in order to provide security of patients' data, all data have been anonymized and coded electronically using an Excel spreadsheet. Totally 3,840 participants have been included in this study. 24.2% were male and 75.8% were female participants. The characteristics of individuals included in this study this information is presented in this slide. As you can see, the women examined were older than male participants. However, the cases of increased blood pressure numbers, systolical blood pressure, and diastolical blood pressure levels prevailed among male participants than female. Among all examined participants with systolical blood pressure 130 millimeter mercury or more, it was below the 130 millimeter mercury, it was 27.4 for participants with increased systolical blood pressure, and with systolical blood pressure less than 130 millimeter mercury, it was 72.6%. However, in total, patients with hypertension, according to the clinical guidelines, were identified in the 32.4%. Among male, it was 41.7%, and among female patients, 29.4% respectively. The characteristics of individuals included in the study are presented at this slide. As you can see, according to the risk factors, there were fewer smokers among women than male participants. According to the type 2 diabetes, we found significant difference among gender subgroups. And type 2 diabetes was also less common among female than male patients. In terms of the number of patients who suffered from acute myocardial infarction or stroke survivors, the compared subgroups, gender subgroups, were comparable. The characteristics of participants' awareness of hypertension is presented at this slide. And as you can see, among the study participants, awareness of the presence of the hypertension was significantly higher among female participants than male participants. Totally of the group of the study participants, approximately 52% of all participants, individuals they examined, they were aware of the presence of the high blood pressure. And characteristics of participants taking antihypertensive medications has been also analyzed. And as you can see, of the 1,243 study participants examined, only 44.4% were taking antihypertensive medications. According analyses among two gender subgroups, you can see that compliance for taking antihypertensive medication was higher in female patients than male patients. What about measures taking regarding identified patients with hypertension? Participants whose level of the blood pressure were consistent with the current definition of the hypertension. They have been provided with written dietary and lifestyle recommendations. Also, above mentioned patients with revealed high blood pressure, they were referred to receiving antihypertensive medications and or follow-up support according to local facilities. So, conclusion, measurement of the level of the blood pressure levels among adults, all 18 years old and older urban residents of the Bishkek city have been revealed high level of the blood pressure in about 1/3 of them, 32.4%. A low level of the adherence of antihypertensive therapy was revealed among hypertensive male and female urban residents, 26% and 52.7% respectively. And further investigations are needed to identify hypertension not only in urban but also in rural regions to prevent outcomes of hypertension. Thank you for attention.